to Let's Chat with Dr. Celeste, MD. I'm your host, Dr. Celeste Reese-Willis. I'm your board-certified family medicine physician. I help busy professionals to find solutions for their acute and chronic medical needs through my concierge medicine program, virtual medicine program, through my brand new Amazon best-selling book, Vitality, and through national speaking engagements. Good afternoon, everybody. I am so excited today to welcome you to Let's Chat. We have a very special guest for you today. She is my medical mogul sister. Hold on a second. I'm going to have to, I apologize. Just trying to make sure that we're not, so hold on a second. Sorry.
Oh, that's good. It's just to share everything.
Correct. Just trying to make sure that we are sharing this with everyone. Eye considerations during COVID-19. Hold on a second. Sorry. Because we don't want any background noise, but we want to make sure that everyone sees it. Okay. Good afternoon, guys, and welcome. Again, I'm Dr. Celeste. I'm your board-certified family medicine physician. I have busy professionals to find solutions for their acute and chronic medical needs. I do this through my concierge and virtual medicine programs, as well as my brand new Amazon best-selling book, Vitality, and through my national speaking engagements. Good afternoon and welcome. Again, guys, you know that I promised you a special guest. We have a very special guest on our show today. I'm so super excited to introduce to you my medical mogul sister. She is my sorority sister. She is also my accountability partner for MMA 20. That's Medical Moguls Academy of 2020. She's a board certified optometrist who brings to us over 20 years of experience, guys, 20 years of experience. This lady knows her stuff. Trust me. Anytime I have any eye issue, the first thing I do is pick up my phone and call Dr. Mesheca to say, hey, wait a minute. What is this? What's going on? She also is the new president of the Maryland Board of Examiners in Optometry. She's a co-owner in private practice with her husband, Dr. Lamont Bunyon, who's also a board-certified optometrist and medical mogul. They own a business, Special Eye Care, in Camp Springs, Maryland. She's also the host of her own show and a brand new Amazon best-selling author. But I don't want to take all of her shine away by telling you all the reasons why I respect and love this wonderful young lady. I want her to introduce herself for you. So, Dr. Mesheca, share with us today.
Well, first of all, Dr. Celeste, thank you so much for having me on your show. I am so honored. Yes, you're my soror, my accountability partner, my fellow classmate in Medical Moguls 2020. Thank you so much. But for those of you who do not know me, and those of you who do, I'm going to reintroduce myself. I am Dr. Mesheca. I'm a leader in optometry for over 20 years, just as Dr. Celeste has said. I am also a speaker and a best-selling author. I educate the public on eye health and eye beauty, and I also help doctors and healthcare organizations with staff management and development. I do that through coaching, through signature workshops and retreats for offices, and now through my best-selling book, Fix My Staff: Tools to Create and Retain an Unbreakable Team. And you can find me all over social media at Dr. Mesheca, and that's DrMesheca.
Okay, awesome. Thank you, Dr. Mesheca. And yes, she definitely can give you the tools. Any of you out there that are listening that own a business having any staff issues, especially in a clinical setting, she actually is the person that you want to call to help you get your staff together. She has some strategies and programs that have proven very, very beneficial for a lot of physicians and people that are involved in clinical medicine. So thank you so much for joining us today, Dr. Mesheca. Thank you, everyone who's taken the time out of your schedule to join us. I see my sister, Kim, from Chicago has joined us. Hi, Kim. Thank you so much for joining. Buhan, thank you for joining. Hi, Miss Taylor. Thank you so much for taking the time out to join us. And we have Dr. Rita on. She's our cycle doc. Hi, Dr. Rita. Thank you for joining us. And then we have your hubby is on, Dr. Mesheca, Dr. Bunyon. Thank you so much for joining us. So, ladies and gentlemen, good afternoon. I thought what we would do today, so excited to have Dr. Mesheca here. You know that we've been sharing different tools and tips with you, trying to help us navigate what's going on with this pandemic that we're dealing with COVID-19. And as part of that, what I thought would be beneficial for us is that there are some things that are going on in patients who are positive for COVID related to their eye care. And so paying attention to our eyes during this period of time is something that's important. And so I know that I've gotten questions for some patients on different things like, oh, is this concerning? Is this something that I need to watch out for in relation to their eye care? So I thought it would be a great idea to have Dr. Mesheca come on and share with us, out of her 20 years of experience, some of the things that she's concerned about. You guys know that one of the things that I encourage people to do all the time is making sure and giving our tips about decreasing the risk of spread of COVID. We've talked about not touching your eyes, your nose, or your mouth. And so that's something that you guys probably are tired of me saying it, but encouraging people to not do it because that's an entry point for COVID-19. So my first question then, Dr. Mesheca, would be, can you help us understand why it is I'm so obsessed with sharing people to touch their eyes or their nose or their mouth in relation to COVID-19? What your opinion is about that particular aspect?
Dr. Celeste, yes. I believe that the main reason that the CDC has been telling us this, and you've been telling your viewers this as well, is that the virus attaches itself to mucous membranes, and those mucous membranes are of the eye, of the nose, and the mouth. Mm-hmm. So that is the main reason why they're telling us not. And then if the virus attaches to those mucous membranes, then that is an entry point into the eye. And then, of course, there are other things that can happen if it does attach itself to the eye, the mucous membranes.
Okay, awesome. So that's one of the reasons we want to avoid touching it, is because it's an entryway point and can attach to that mucous membrane. Okay, so that leads us to our next question, Dr. Mesheca, and that is, I know that we've heard that COVID-19 can attack the eye. Mm-hmm. What is the disease process that occurs, or that you're seeing, or that you have seen in some patients in the last several months that you've been seeing patients? Because, and we'll get into that in just a moment, exactly how it is that you and your husband are helping to protect yourselves while you're at work. But what is one of the main diseases that you're seeing in relation to COVID-19? Can you share that with us?
Yeah, so one of the things that we are seeing is viral conjunctivitis. Okay. Now, it does, according to the CDC, it does happen a very small amount, about 1 to 3% of cases. Okay. And viral conjunctivitis is, people call it pink eye. Okay, so that's a term that most people use. Mm-hmm. Viral conjunctivitis is caused by a virus. It's an inflammation of the conjunctiva, or those mucous membranes that cover the eye. Okay. Though the signs and symptoms of a viral conjunctivitis would be typically a patient's coming in because their eyes are red. They're not, drastically red. I would say like a light pink. So that's why it's called pink eye. Okay. The eye, it starts with one eye, and then probably within 24 to 48 hours, it spreads to the other eye, because viral conjunctivitis is very contagious. Okay. Now, I will say that because reports are showing that it has only been found in 1 to 3% of patients that have COVID-19, mm-hmm. you can have just a common cold and get a viral conjunctivitis. Okay. So just because you come in with certain symptoms, such as your eyes being red, tearing, mm-hmm. on the exam, we see little fine bumps or follicles in the lower sac of the eye. Okay. It does not mean that you have COVID-19, but it does mean that you have viral conjunctivitis.
Okay. So those are the symptoms. of the viral conjunctivitis is that pink eye. Do they typically get crusting or tearing with that?
They can get a lot of tearing. And like I said, it does go with, we know that it's viral versus other types. There are other types of conjunctivitis too. There's allergic, there's bacterial. Right. But with viral, it typically spreads to the other eyes. It's highly contagious. So we have to tell patients, if you have a partner, you don't need to share pillowcases or washcloths and things like that. But it can cause some crusting in the morning just because of all of the tearing. So that can definitely be a sign.
Okay. Just putting this in the chat. You said do not share pillowcases if you have viral conjunctivitis. Okay. So that brings us to our next question, which is, okay, we've identified that it's viral conjunctivitis. How do you treat that, Dr. Mesheca?
Well, just like you can have the common cold or any type of virus, physicians like yourself, Dr. Celeste, may tell the patient, go home, get some rest, drink plenty of fluids, because this is something that is going to take time to go away. Okay. It is the same thing for a viral conjunctivitis, a virus in your eyes. Okay. Of course, taking fluids may not necessarily help, and it may, but we would tell patients to use artificial tears to kind of help flush their eyes out with a viral conjunctivitis, because typically it doesn't hurt patients. It's just, and most of the time, people that have viral conjunctivitis, they do have some type of upper respiratory problem. They may even have some nodes that can be palpable to let us know that, hey, you may have something kind of going on here. So same thing, rest, plenty of liquids, but add artificial tears for your eyes. And sometimes cool compresses will work as well.
Okay, awesome. Okay, so cool compresses and artificial tears. Any instruction, Dr. Mesheca, as far as, let's say, if they're cleaning their face like daily, these are, and I'm asking you the kind of questions that most patients ask me, and primarily what I tell patients is, if you have any kind of conjunctivitis or anything extremely contagious, after you wash your face, you just want to make sure you wash it in the washing machine.
Yes.
With warm water. Any other insight as far as how often they should be cleaning their eyes and worrying about touching things? Any recommendations as far as that goes, since we know that it's extremely contagious?
Yeah, and just in general, not to rub their eyes a whole lot. Now, once it has, been transmitted from one eye to the next, you can wash your face. Just make sure you're rinsing it off really well with warm water. If it's just in one eye, then no, you don't want to wash your face and then go over to the other side. You may have to use a different washcloth. So, although it's a little annoying to have to use two, that's what you have to do when you have viral conjunctivitis.
Okay, awesome. Okay, thank you so much. Now, next question. So you said, everyone that has viral conjunctivitis definitely doesn't have COVID-19. Okay, so two questions actually. When they come in to see you, are they generally already, for the patients that you've seen that are positive for viral conjunctivitis, have they been checked for COVID-19? If they haven't been checked, do you recommend them to be tested? If you can answer that for us, Dr. Mesheca.
Well, I will say most of them have not been checked coming into my office. We do ask. We have a general questionnaire that most of your viewers have probably seen if they've gone into any doctor's office any time between the end of March and now. There's a COVID questionnaire.
Right.
And then, we do a good job in both of the offices where I work to ask patients over the phone, have you had COVID-19? Have you come in contact with someone that has had COVID-19 within the past 14 days? So we do ask. So no, they typically do not come in saying, because we have to protect ourselves and our staff members as well.
Okay.
Generally, if someone were to call and say, hey, I have this, what I feel is a pink eye, but I tested positive last week. Can I just come in and you take a look? My answer is probably going to be no, because at that point they are contagious.
Okay.
And I will do a telemedicine visit with them. Because generally we can see what we need to see. If a patient gets close enough to the camera, I can tell based on their signs and symptoms. And again, there's no treatment for viral conjunctivitis. So it's best that they stay home if they know they have COVID-19.
Okay. So would you recommend, though? So question, because telemedicine definitely has played a large role, we're seeing with this pandemic with COVID-19 and being able to deliver healthcare to patients. So would you recommend, though, that they do a telemedicine visit, even though we know that if it's viral conjunctivitis, the treatments are just supportive, which is what you described earlier, but would you still recommend them to get a telemedicine visit, though, so that we can know for sure that that's what's going on, or what do you recommend?
Absolutely. I would definitely recommend a telemedicine visit. Now, sometimes, patients call and they make an appointment and they may just say, hey, I'm having a little blurred vision and tearing, which can be signs, but they may not tell us over the phone that they have pink eye. And so when they get in is when we find out, like, oh my goodness, we have to be careful about the exam areas that they're in, because again, this is a contagious conjunctivitis.
You're right.
So it is best that if you do have those type of signs and symptoms, just call your eye doctor first and schedule a telemedicine visit.
Okay. Awesome.
Now, but you did ask about whether or not we would. So for instance, if I had a patient a couple weeks ago, the same sort of thing, he did not say that he actually had a pink eye. He said just that, a blurred vision tearing, so, okay, you can come in, you haven't been in a while. Okay. But when we got in, we found out that, yes, not only was it viral conjunctivitis, but this patient had been working in a nursing home. So I did ask, so I did ask, hey, have you been tested for COVID-19? No. I haven't been sick at all. I haven't felt sick. They take my temperature every day when I go into my, into the office. So I recommended that he did get tested. But when he came back for his follow-up, he still had not been tested. His conjunctivitis was gone, but he had not gotten tested yet.
Okay, so let's take a part here for just a second, Dr. Mesheca, and address that, especially for our viewers that may be listening. So you're saying that you recommended the patient be tested, but he didn't go in to get tested, and that he works in a nursing home. So for the benefit of everyone here, especially because we have Dr. Mesheca here, who can attest after 20 years of experience in seeing eye care and giving eye care, rather, to the Maryland community, etc., over the last 20 years. How do you, and I know, in your opinion, how important was it for him to be checked from an eye standpoint? Are they giving you any figures for us to know? And I know that there's a lot that we don't know about COVID-19. We're still researching it. It's a new virus. That's why I call it the novel coronavirus, so that there are things that we're just learning as we go, so to speak. In your opinion, what would you say would be the level of risk for him having COVID and eliciting it to someone in the nursing home?
A very high level. We actually wrote him a note to stay out of work for 14 days, to be quite honest.
So did he do that at least? I'm sorry.
Yeah, he said he did. He said he had not been back to work, so that when he came back for his follow-up in 10 days, his eyes were better. And we just recommended, hey, did you go get tested? No, I still didn't get tested, but my eyes are better. I need to get back to work. Can I have a note? And, I couldn't give him another note. The note expired on X amount of days because we really wanted you to get tested.
Right.
And that 1 to 3% of patients with viral conjunctivitis can have COVID-19. So I feel like we did our part as a practice. Whether he went back to work on his own, I have no idea. But I do think that in those instances, patients should, you should think about where you're coming in to be seen. Think about your workplace. You really don't want to risk infecting anyone else.
Right. And undoubtedly, what would be our obvious concern in this situation would be him being someone that works in the nursing home, dealing with a vulnerable population, as most people that are in the nursing home are a vulnerable population, because most of them are elderly and have comorbidities that increase the risk of getting COVID-19. So just to share with anyone that may be listening, guys, this is part of what we touched on a little bit earlier this week about how important it is if you know that you're sick. So similar to if you have a fever, if you know that you have this viral conjunctivitis, and especially if you work in a field like in any healthcare related field and have exposure to people that are a less vulnerable population, it is imperative that you get checked and not cause a ripple or domino effect in that environment. We saw that earlier this week and with a few patients that we saw in urgent care. So just wanted to take a part there to bring some awareness to that if you're sick, guys, and if you have a fever, if you're having red eyes and you're not sure, if you are someone that's busy, it's like, hey, I don't have time to go to the doctor. Most physicians are providing telemedicine services. I know that Dr. Mesheca is doing that in Maryland. She will share with us all the places that she's available shortly, but we just want to make sure that we encourage everyone. This is one of the main gateways that the CDC has put things in place to try to block the domino effect. Having one person that's extremely contagious can cause a domino effect, especially in situations and in places like if you're in a home and a lot of people live in that particular home, then, and it's a short, tiny spaces or areas of tiny space. That is an area wherein COVID-19 can proliferate easier. In addition to that, if you're in a nursing home, you're dealing with a more vulnerable population that it's easier for them to contract COVID-19 than it is for someone that's healthy, that does not have heart disease, does not have asthma, does not have COPD, and does not have congestive heart failure, something else that puts them at risk for getting it. But that COVID-19 can kill them. It may not kill you, but it can kill them. So we're taking these protective measures to try and protect that population. So just wanted to share with that. Just didn't mean to necessarily get on a long tangent with that, but you know how I am about COVID-19, Dr. Mesheca.
Stay home.
Right. Stay at home, guys. If you're sick, please stay at home. That's what's gonna help us all protect one another. If the people that are sick can stay at home, if you have to leave, please make sure everyone wear a mask when you do. But not to delay the point much more, Dr. Mesheca, you shared just a moment ago. Let's talk about eye exams, because that's something that a lot of people are thinking about right now. They're like, should I go get my eye exam? And if I do go get my eye exam, should I be getting my eye exam? If I do go get it, you just told me that the eyes are an entry point. So how are we going to make sure that we stay safe? So if you could touch on that for us, Dr. Mesheca, what you and your husband have been doing in your practice to try and decrease the risk of COVID-19, and your opinion about eye exams at this point.
So I do think that eye exams can be performed in a safe way. Okay. We in our practice and in most optometry practices, because I'm in a lot of different communities online, we're doing a lot of things to keep ourselves safe as well as our patients. So one thing is, you won't come into if eye doctors are following the protocol that they should be following, okay, you won't come into an eye doctor's office and there'll be a ton of people in the waiting room. Okay. Most of us have instituted a check-in from the car, protocol where patients are calling before they get there. If we have 1 or 2 patients that are already in the facility, we may have them wait. Some offices like ourselves will have our staff to go out and give paperwork to patients if that's needed, because actually now we have a new app that we use where we send the paperwork. Yeah, so
love it. I love it. I love it.
Yeah, so in our office, Special Eye Care, it's an app that my husband found where it sends the patients their paperwork, so they're able to fill that out and they can send it back to us prior to them coming to the office. So that works well with new patients and established patients.
Okay.
We typically if we try to limit where the patients are in the office, if they do have to be pre-tested, we do have our staff pre-test them, and then they go directly to one of the exam rooms where the doctor comes in. We're just doing a lot of things to sort of limit where the patient is. And also, every area that a patient is touching, every room is disinfected before another patient comes in. We even have a system for that.
Yes. I'm not surprised. You have a book that's called Fix Your Staff. So I know your office, if anyone's office is COVID proof and everything, I know yours is.
Yes, I think we've worked really hard. We've watched a lot of webinars through the American Optometric Association, and as well as other associations and companies that are really telling us how to practice eye care safely, because as your viewers probably know, we are doctors where contact is a must. We are very close to the patients.
Correct.
So, there's no such thing as us practicing true social distancing between the doctor and the patient in the exam room. Okay. There are other things that patients are going to see. As far as there's a machine that we use that we look inside of your eye with, called a slit lamp, where there's a shield, a plexiglass type of shield or plastic shield that is between myself and the patient. Okay. But again, I'm already protected. I have a mask. Sometimes I don't wear it all the time, Dr. Celeste, but I do have a shield. And yes, it does. But we also have a shield on the slit lamp that is also protecting us and the staff between us and the patient as well. So we've taken lots of measures to make sure patients are safe coming to get their eyes examined by an optometrist.
Okay, awesome. So you guys heard that they have put into place plexiglass, which is going to help to form as a protective measure to help protect Dr. Mesheca from the patient, as well as to help to protect the patient from Dr. Mesheca from the patient and the patient from Dr. Mesheca. Sorry, tongue tied. So that's awesome. So you are still recommending that people get their regular eye exams, just making sure that they do it in a format and in a way, and with an office that is following the guidelines that have been set out by the CDC, which would include everything that you mentioned as far as, a lot of what we're doing here in terms of urgent care visits, regular clinic visits. Most offices here have transformed into doing that, so that's the kind of atmosphere, guys, where you're going to be most protected, is in that kind of atmosphere. Okay. Not sure what happened. The weather looks questionable outside, so I don't know if that's what knocked me off or not, but I apologize. Thank you. Down, Dr. Mesheca. So,
and also, Dr. Celeste, I want to add that another thing that we are doing, and most optometrists I hear are doing, and you're supposed to be doing this, is checking the temperatures of your patients that come in the door. I think that's great to it's a great measure, because of course, if a patient has a temperature that is above normal, we use 99 as a point, then more than likely we won't see them that particular day.
Right.
We're asking them the COVID questionnaire questions. They only come in by themselves. They're not to bring in any other family member. And at our office, we also have an oximeter that we take to measure patients.
I love
as well.
it. Now, I love all of that. I love all of that.
You do.
Because that's, you know how I am. And that's so sad that I get excited about these things, but this is how God made me. So it's what you get. But the pulse ox and so the reason why that's important, guys, and she's mentioning that, is that the pulse ox gives us a measure of how well your lungs are being perfused with oxygen, so that if it's low, then what Dr. Mesheca and Dr. Bunyon are going to tell you is, hey, you know what? Just like if your temperature is elevated or if the oxygen level is low, they're going to recommend that you see your regular physician and get a further evaluation to make sure that nothing's going on in your lungs. And because we know that COVID can be asymptomatic, this is a very important measure. There are patients that we're seeing that go to a dental visit or go see their eye doctor or go, for a secondary service that they may not have seen their primary care doctor for. And you're finding that, oh, this patient is sick or they have a temperature elevation, because everyone doesn't have a thermometer at home. Although I think having a thermometer at home, and when I say a thermometer at home, I mean one from Walgreens, one from Walmart. I don't mean going out and buying a thermometer that would be needed for a health clinic. You don't need that. You don't need the thermodynamic thermometer that they scan you with and certain practices. That wouldn't necessarily be needed, although I would love to have that in my house. But anyway. But these are the ways that we're helping to catch some patients that may be falling through the cracks in terms of being an asymptomatic patient that could be positive for COVID. And the reason why it's so important is because we just want to know who's positive, so we know who to say, okay, guys, we need you guys to stay over here and chill for a couple weeks, and it's okay for you guys to go out and continue to work or what have you, depending on where it is that you live. So these are very important things. Thank you so much, Dr. Mesheca. I don't have any other questions that we're going to ask now. I have some other ocular questions, but we'll save it for another episode. Hopefully she'll take time out of her schedule and come back and share with us as far as some other things in eye care to be concerned about, including, and I don't know if there's any specific one other thing you want to share with us, Dr. Mesheca, before we get to any questions. I know that there have been a couple of questions in the chat, but anything else that you, with all of your experience and what you're seeing now with COVID-19, anything you'd like to share with our audience to help us know better how to care for our eyes during this period in time during COVID-19?
Well, I will say that now that I'm in the office just about full time, I'm seeing a lot of dry eye syndrome. But the dry eye syndrome that I'm seeing is basically coming from patients using more digital devices, more screen time.
Oh, okay.
Yes, so we're seeing a lot of that. So, to protect your eyes from that, I know most of the world, other than us in healthcare, are home teleworking. So, you still want to make sure you are taking breaks at the computer. If you wear prescription glasses and actually non-prescription glasses, the lenses should have blue light blocking ability to help protect your eyes from eye strain. And the longer that you stare at a computer, that is why you can develop dry eye syndrome. Some of those symptoms could be not necessarily that your eyes feel dry, but you may complain about tearing a lot, blurred vision, double vision, just general eye fatigue and headaches as well, because you've been on the computer all day. Okay. So that would be my biggest thing, to, try to take some time away from the computer. We use the 20-20 rule. I know that it's not very easy. Every 20 minutes to look away for 20 seconds, 20 feet away. But at least every half an hour or so, just kind of give yourself a break by looking around the room to relax your eye muscles.
Mm-hmm. Okay, awesome. So the 20-20 rule, every 20 minutes, look away from the computer.
Mm-hmm. For 20 seconds.
Computer
and
for 20
try to
seconds.
look 20 feet away. So, beyond.
Okay. Just including it in the chat because I think that's important. That's very important. Thank you, Dr. Mesheca, because we don't want dry eyes. We do not want dry eyes. We don't need any other issues. We have enough that everyone is dealing with today, definitely and for sure. So thank you so much, Dr. Mesheca. So let's look in the chat. I know that we had a couple of questions. We had a couple of other people to join us here. Let's see. Hi, Miss Muhammad. Thank you for joining us. She has a question. She says, does it matter in the treatment with the viral conjunctivitis? You talked about artificial tears. She asked, does it matter if the artificial tears are preservative free?
Actually, they do not matter. You just do not want to use drops that say gets the red out. So no, I don't want to say a brand, but you don't want to use you do not want to use drops that say gets the red out. You want a drop that says artificial tears. So it can be, it's better if it's preservative free, if you can find that in your local pharmacy. But preservative or preservative free is fine. One drop at least 4 times a day.
Okay. Preservative free is preferred.
Yes.
Okay. Thank you, Dr. Mesheca. Hi, Dr. Rita. Thank you for joining. Dr. Rita has a question. She asked if there's a higher prevalence of the viral conjunctivitis in children.
No, now that I have not seen or read as of yet that it is a higher incidence. And in fact, I don't know what the incidence of COVID-19 is in kids. So I have not seen a lot of viral conjunctivitis in children at all. Okay.
Well, and to speak as far as the prevalence of COVID-19 in children, it actually is less prevalent in children, but there's a subset of children that are having different symptoms that they present with. There was an article a couple of weeks ago that discussed some of the GI symptoms of vomiting and diarrhea that some children have been presenting with. So,
wow.
COVID is just, it's its own animal. For the most part, we are not seeing an overwhelming amount of children be infected with it, but it is happening. There was one case that I saw this week where a 2-year-old little girl was positive, and as a result of her being positive, 2 sides of her family had to be checked because they had a family gathering the week prior, and she ended up passing it on to an uncle that lives in a house away from her, but her mom, who cares for her most times, did not have it. So the pattern, I know. So you were skipping the mom, but then the mom infected someone else that she worked with. So, right. So, COVID has a different pattern. We're seeing various patterns in the way that it moves and infects one patient to the next, and even a different presentation of symptoms. There are some patients that'll come in, and you may or may not have seen this, Dr. Mesheca. I know that I am. Patients that come in that may present with, you can have a wife that presents with fever and a cough, and then the husband just presents with loss of taste or smell. We're seeing that degree of variation in how it manifests in some patients. Not all patients have the same symptoms, which is why I usually recommend patients be familiar with all of the symptoms so that you don't think, oh, well, my husband presented with fever and cough, and I don't have fever and cough, so I know I don't have it. It may present in a different way with you. So that's something that we should keep in mind. Okay, let's see if we have any other questions. Hi, Dr. Monica signed on. Thank you for joining, Dr. Monica. Hi, Dr. Janine. She joined us. Thank you. And then Mr. Willis is here. Hi, Mr. Willis. Thank you for joining. And then our my sis, hi. Thank you for joining. And Miss Taylor. Hi, Mr. Parkin, Mr. Desmond Parkin. Thank you for joining. And Miss Matricia Brown. Thank you for joining us. And Mr. Michael Brown, thank you for joining. So it looks like Miss Brown has a question. She asks, are artificial tears also used for dry eye syndrome?
Yes, artificial tears are. But dry eye syndrome is an inflammatory condition And there are special drops that can also be used for dry eye syndrome, depending on the severity of your symptoms. There are other testing that we can do in the office to determine the level of dry eyes. So we may start you off with artificial tears, but we may also put you on a complete plan with lid scrubs to make sure your eyelids are clear, to make sure the glands along the lid margins are clear, called the Meibomian glands. And we may prescribe, there are there are a couple of drugs on the market now that are really great for inflammatory dry eye: Restasis, Cequa, and Xiidra. So those are the top three that I will prescribe to a patient depending. So yes, they are.
So you treat with prescription eye drops.
Yes, prescription eye drops for patients that have more severe symptoms.
Okay. And so it looks like Mr. Parkin has a question. With social distancing, seeing less patients, thus less revenue, and cost of PPE, are any practitioners, this is a very interesting question, are any practitioners increasing exam fees?
Now, we have not, but I am hearing some of my colleagues say that is probably the way that we're going to have to go, because he's right. We cannot, where we used to see 30 patients in a day, that's probably cut down at least by a third. Because, we do have to be careful. But I guess it hasn't really, it has caused a decrease in revenue, but then on the other hand, for practices like ours, where we are full service, we have a full service optical, patients can come in and they can probably spend a little more time with choosing frames, so they tend to maybe spend a little more money if they're spending a little more time in the practice. So it really depends.
Okay. Great
question.
So you made reference, so you open the door, so I'm going to walk through it. You made reference to your full service eye center that you and your husband have, and you made reference to your frames. Y'all, I want her to show you. She doesn't have on any today, but I want her to show you some of her frames. They are spectacular. And I want her to start her own. I want to wear glasses just so that I can wear some of your frames, Dr. Mesheca. I was hoping to have some on today. They're always so fly and so super cute, the frames that you have on. Do you have any today with you? Not necessarily.
No, I don't have any right here. I don't have any on today, but I have to do some pictures and you can post some on your page.
Right. Okay. Yes, I will do that for sure. For sure. She has one pair that I love that are white, that one with the white pattern. The ones that are white that come up like the Jackie O, I think.
They're the crystal. They're like crystal
frames. Yeah, super cute frames. But okay, so that's a very interesting concept. I did hear also that there are some practitioners that have talked about increasing their fees because of the decrease in seeing patients, as well as the cost of PPE. And I know that Dr. Mesheca, wearing PPE all day and seeing a patient is definitely having its toll on all physicians across the country. I know it definitely has its toll on me in terms of, wearing the mask all day and being enclosed in a get up all day. You're not drinking as much water. You're not exhaling as much CO2. So you're going to get a little bit of CO2 retention, which we usually work itself out with exercise and things, but which will make it harder. It takes a little longer to see a patient right now in trying to take measures to help protect them. So does anyone have any other questions? Hi, Ms. Bryant. Thank you so much for joining us, Ms. Deborah Bryant. We'll wait just a second. Anything else you want to share, Dr. Mesheca, before we sign off?
No, I would just say, if you're having any type of symptoms or problems with your eyes, like viral conjunctivitis, if you're finding that now that you're teleworking, your eyes feel more tired at the end of the day, just talk with your optometrist, your eye care professional.
Okay. So Dr. Mesheca, thank you so much for joining us. Okay, Mr. Parkin has one more question. He said, what do you think of teleoptometry? He said, I am old. Am I missing something? So he's asking what, and Dr. Mesheca actually hit on this a little bit earlier, but I'll let her share her answer with you, Mr. Parkin, about what she thinks about teleoptometry.
I think it's great. You know, I was a little apprehensive about it because I'm just starting to use the technology as well. But since we have the technology, why not use the technology? Okay. And I have patients that are, you know, from, actually children to patients that are in their 90s. And I have seen those patients who are in their 90s. Wow. On televisit. Now, they do have someone helping them, and sometimes I have to call them on the phone to have, you know, to kind of coach them how to log in. It might take, you know, a little bit, but they get there and I finally see them on the screen. So why not just use the technology that we have? We all need to embrace it. Yes,
we all need to embrace it. Shout out to the 90-year-olds doing telehealth, okay?
Yeah,
about it. Shout out to the 90-year-old. I love it. And that was actually Dr. Desmond Parkin that was asking about the telehealth.
Oh, yes, I know him.
Okay, and I'm not sure what facet of medicine he serves in, and whether or not.
Oh, when you said the name, I was like, Parkin. Yeah, he's an optometrist.
Okay.
I think he's in New York. I'm pretty sure.
Okay.
Yeah,
so, no, Dr. Parker, you're not missing anything. Dr. Mesheca will help keep you caught up to speed. She's a medical mogul. She'll get you caught up with the teleoptometry. But I was curious about that, how much you guys have been using telehealth. And so it's encouraging to know, though, that even in optometry, which is a very sensitive kind of healthcare, for the service that you're providing to patients, but even in that facet, you're able to provide services with them through telemedicine. So it sounds like and seems like that this is an area that probably is going to just keep growing and growing and growing in terms of telemedicine. But it's very interesting to see how we've all kind of been forced to use it at this point, but the ways in which it can probably help take your practice to another level. Is that something that, because I know that you also have a group of providers that you have that follow you and that you give advice to about things in their office. Is this something that you're incorporating as a part of your strategies that you use to share with them in their practices?
Yes, definitely, to just embrace the technology. Now, there in eye care, of course, we can't do a televisit and you need new glasses because that's a whole separate thing. Okay. You actually have to come into the office to have a refraction, performed properly.
Okay. So there are limitations. There are limitations. Okay, but that's fair though. But it actually has its value that it adds, and you being able to provide service even now and in this environment. And God, we pray to God that we don't have to visit. Going back into our homes again, but just being being realistic and knowing that flu season is coming. That's a concern. But knowing that you're able to provide services even through telemedicine is awesome. I think it's absolutely awesome and speaks to how technology has afforded itself a chance for us to be able to kind of propagate a little bit in how we deliver healthcare services. So I think it's awesome. So Dr. Mesheca, do you want to let us know? And I know we talked about so many different things that she does, and I'm so proud of her. She's my Sarah, but she's also a friend and my medical mogul sister. So happy to have you on today to share all of your words of wisdom to us in eye care. Can you tell us how we can get in touch with you? I know you have a brand new book. I know that you're helping people fix their staff.
Yes. So if you are a healthcare provider or someone from a healthcare organization that's watching, you can look at it, an excerpt of my book, or check it out at fixmystaffbook.com. But you can also find me on all social media at Dr. Mesheca. And again, that's DRMESHECA.
Okay. And then lastly, you have a show that you do, and I'm putting her on the spot a little bit. You have a show that you do with your husband, which I think is absolutely amazing, and I love it. I absolutely love it. You guys are great on your show. I don't know if you want to share that. If people may want to check your show out on Wednesday nights, isn't it?
Yes, but we're gonna start. I'm not sure if we're gonna do Wednesday. We did Wednesday nights in May, so
Okay.
we're talking about what would be the best day in June. Okay. Last week was, such a challenging week for all of us with everything that was going on. So we took a little break from our show last week, but it's called 4 Eyes in Vision and Love. And you can find us on Facebook there. Just type it in, and we have our own page there as well, where we talk about eye care and we talk about, being husband and wife and being parents. So it's definitely been a great experiment and journey. So hopefully we will keep that up.
Okay, awesome. Well, I know that you guys are providing a resource and inspiration for those of us that are out there, especially you both working in eye care and being a husband and wife team. You're an optometrist team, and you're also parents and teamwork as well. Yeah. And so you have done a great job on your show of helping people learn how to navigate all of that, because that can sometimes be a lot. And we definitely have all seen with the events in the last couple of weeks how a lot of what's going on has worn itself on all of us. And so you guys are definitely serving as a source of inspiration. I thank you so much for taking time out of your day. You know that I will sit on here and talk to you all day, because when we talk. So we're going to log off now. Thank you so much, everyone, for taking time out of your schedule to log on. If you're watching this in replay, please put #replay in the comment section. If you have any questions, please leave those. Guys, you know who I am. I'm Dr. Celeste. I'm your board-certified family medicine physician. I help busy professionals to find solutions for their acute and chronic medical needs. I do this through my concierge and virtual medicine program. I also do this through my national speaking, as well as my brand new book, Vitality. Feel free to follow me on Facebook as well as people that are interested in some of the tidbits that we're sharing with you today. We are having people to join our Facebook group as well, the lively one. So with that, ladies and gentlemen, please feel free. Please go follow Dr. Mesheca on Facebook and all of social media. She definitely will make it worthwhile and valuable for you, as she always does. Thanks so much, Dr. Mesheca, for joining us. Everyone have a good day. Bye.
Bye-bye.